Brilliant. Thank you. Morning all. So this is the second webinar I've done this morning. So apologies to those who are hearing similar things again. But yes, let me get started. I'm Fumi Worrell. I'm the Public Health Service Lead for Health Protection, and I'm going to take you through this webinar focused on adult immunisations. Apologies if there are any issues with my reception. You will let me know, won't you, Lauren, if I drop out, but we will be hopeful and we'll get started. So, we're here today to talk about the impact and outcomes measurements and how they should be a key part of any intervention. I'm going to go through these first few slides, which I've gone through before and you should probably all be quite familiar with, and then we'll focus on adult immunisation specifically. So measuring the impact of what we do helps us to demonstrate that what we're doing is making a difference. And the impact and measurement and outcome measurements help us to demonstrate that an intervention is having an impact in a measurable way, rather than just relying on stories or anecdotal data. So using standard tools allows us to compare different interventions' impact, and combining these standard measures with standard questions on people's identity helps us to understand if different interventions are more effective for different groups. We can also combine them with information on costs of an intervention and the numbers of users, and that helps us to look at the cost effectiveness of each intervention. Without clear impact and outcome measurements, it's difficult to support funding for interventions or justify that the approach should be continued or scaled up. So the Birmingham Public Health Measurement Toolbox has been developed to standardise impact and outcome measures for interventions that are trying to improve the health and well-being for our citizens across Birmingham. The Toolbox supports organisations when they're developing projects to build the appropriate measures into their service design. And it provides clarity and transparency on how to clearly assess and measure interventions based on their focus, which can then be demonstrated clearly when applying for funding. So it allows for accurate and meaningful comparisons between different programmes and interventions, and helps with decision making. So the Toolbox is being developed, and it's a set of resources that support measurements related to different areas of health and well-being, and these include, but are not limited to, physical activity, smoking, mental well-being, high blood pressure or hypertension, long-acting reversible contraception, HIV and hepatitis risk reduction, and of course, adult immunisations for today. So the webinar follows a structure where each section there will be a description of the issue or topic, links for local or national information on the issue or topic, a description of the tool being used, information on any registration requirements to use the tool, useful links to support behaviour change and evidence-based interventions related to the topic or issue, and then a case study example of using the tool in practice. So let's get on to talk about adult immunisations. So first, what's the difference between vaccinations and immunisations? So vaccination is the act or action of getting a vaccine. And immunisation is when you become immune or resistant to a disease. And in this context, that's through the act of vaccination. So what are immunisations? Well, the WHO says that the two public health interventions that have had the greatest impact on the world's health are firstly clean water and secondly vaccines. Vaccines have been shown to prevent 3.5 to 5 million deaths every year from diseases like diphtheria, tetanus, pertussis or whooping cough, influenza or flu, and measles. Vaccines reduce the risk of getting seriously unwell or even dying from a disease by working on your body to build its own natural defences. So how do vaccines protect the community? This slide shows two graphics of how vaccines work. So in the first graphic, you can see that when no one is vaccinated, a disease can spread easily and rapidly through a population or a community. However, when the population is vaccinated up to 95%, which is what we call herd immunity, then the spread of the disease is controlled and can actually be stopped. And very importantly, with the 95% herd immunity rate, you can also protect those who are not able to be vaccinated as well and prevent them from getting ill or dying. So what are the adult immunizations? So vaccines for adults include the influenza or flu vaccine, the pneumococcal vaccine, and shingles vaccine. And of course, COVID is in there as well. However, adults can also catch up on any part of the whole routine immunization program that they have missed. So adults can catch up on things like MMR vaccination if they were not vaccinated completely as a child. And you have a chart there on the right side of the slide, which talks about the various ages of adults and when they get vaccines. So from 65 years and over, they're entitled to flu vaccination, pneumococcal vaccine, and shingles vaccine. And the shingles vaccine just changed, the program changed last September, and the ages are being reduced. Also, there's vaccines for pregnant women. So they're eligible for flu vaccination during flu season. And from when they're 16 weeks pregnant, they are eligible and should be offered whooping cough or pertussis vaccine. So what are the vaccinations for catching up? Well, it's all the vaccines that you're eligible for as a child, so as a baby from 8 weeks all the way to 14 years old, and then as an adult as well. So that's listed on those two tables there. So what are the adult immunizations? They're immunizations from the UK NHS immunization schedule. They protect you from many serious and potentially deadly diseases, and they protect other people in your family and community by helping to stop the spread of the diseases to people who cannot have vaccines, such as babies that are too young to be vaccinated and those who are too ill to be vaccinated. So to put in some national context, using specifically the flu vaccination as an example, you can see that on this slide, flu uptake for those aged 65 and over increased between 2019, 2020 and 2021, 22. And this was probably the highest recorded uptake in the history of the flu vaccination in that year, but then it did decrease from 22, 23. And there is a phenomenon that's been highlighted by the WHO called vaccination fatigue, and they have linked this directly to the COVID vaccination. So from 2010 to 2011 to 2019-20, the national flu uptake for those aged 65 and over was below the target of 75%, which is the target that NHS England gave us. We always want to aim for 95% because of that herd immunity, but it was lower even than 75, unfortunately. So when we look at local context, we can see that Birmingham's flu uptake for those aged 65 and over is lower even than the national average. And the trends in Birmingham do mirror national trends. Birmingham did not reach the 75% target in that period between 2010-11 and 22-23. So lots of work to be done. So the adult immunizations toolkit. So here is the adult immunizations checklist, and what it is a list of all the vaccinations that were due in childhood that can still be had in adulthood. And then at the bottom of the childhood and adolescent list is those vaccinations for those who are 65 and over. So the first column talks about the age that the vaccination is due. The second column looks at the diseases protected against, and they're all listed there. And then we have the vaccine name. And finally, the final column has vaccine has been received, and that can be ticked if that's the case, or left empty if there is a gap and that they have not had the vaccination. So what does the toolkit measure? It helps to identify any gaps in the routine immunization program for an adult, and it helps with awareness and understanding of personal immunization record and vaccine preventable diseases that an individual is not protected against. The toolkit allows professionals to have open conversations about reasons for not vaccinating and for designing interventions for these reasons. So one example is some people feel that they can't have the MMR vaccination because it contains animal products or pork products, gelatin. But in fact, there is a vaccine, an MMR vaccine, that does not contain any animal products and can be given to any faith or any population and is safe and effective. So that's just an example of an issue that could come up and how the health professional could help to address that. And we also have vaccine-related resources that are used to respond to actual community need. So the measurement tool is the adult vaccination checklist tool. So there is a web link that is a checklist listing all doses of vaccinations from the UK's NHS immunisation programme. The cost is not applicable because it's all free at the point of service with the NHS. It'd be used as a checklist, and the frequency would be pre and post intervention. So pre-intervention to look at what the uptake might be, and then have the intervention, and then look afterwards and see whether there has been an increase in the uptake of adult vaccinations. The ambition, of course, is to increase the number or proportion of adults with completed vaccination schedule appropriate for their age. And we do have benchmarking data, which is the OHID fingertips data, and there's a link for that in the presentation. So using the tool, users can complete the tool on their own if they wish, or they might wish to work with the provider by going through the checklist with them. You may need to support users with recognizing each of the vaccinations listed on the checklist, and you may need to support users to contact their GP practices if they're not sure which vaccinations they have been given. In terms of specific risks and issues to consider, there are three key things. So firstly, matching vaccination record from another country with the UK schedule. So this could be for people who've come into the country and might have a different vaccination schedule. For example, they might not have MMR given as 3 vaccinations in one. They might just have them individually, etc. But the checklist allows for those considerations. Another risk or issue might be accessing medical records if unable to fill the checklist in. And finally, you might have negative attitudes towards vaccinations, but it's really important to be clear on what those attitudes or thoughts might be, as with the MMR example, so that we might be able to offer solutions that work for all. So how to report the findings. The checklist aims to increase awareness or understanding of an individual's personal immunisation record, and you may wish to collect the data from completed checklists on an Excel spreadsheet or Word document, or however works best for you. So finally, we're going to the hypothetical case study. So what is the issue at hand? Well, the voluntary organisation is working with adults in inclusion health groups and/or adults living in poverty. And the organisation is aware that these adults may not be up to date with the UK's routine immunisation schedule. And so they want to decide to deliver an immunisation intervention to increase the uptake of vaccination in service users. So the service users are asked to or supported to complete the adult immunisation checklist. The organisation offers basic information, training and support on immunisations to boost awareness and confidence in collaboration with healthcare professionals, and the checklist is completed after the intervention. And the findings are the voluntary organisation demonstrates that uptake of immunisation in adults is increased, ideally. And we have increased protection against vaccine-preventable diseases, and use the findings to work with local healthcare professionals to increase immunisation uptake. And finally, we have the additional links and useful resources. So if you have any questions regarding the toolkit, please do contact the public health team, or specifically my team, the health protection team, and we'll be happy to support. And then you also have a link of all these other useful links that you can refer to. I'm going to stop sharing my screen. I'm very happy to take any questions.